Hello viewers, my dear students. Today we are going to discuss on the topic Pathophysiology of Megaloblastic Anemia. I am Saraswati Patel, research scholar from Banasthali Vidyapith. Let's start the topic. Pernicious anemia is a megaloblastic anemia, or it is also called as microcytic anemia, in which hemoglobin synthesis is normal but maturation of erythrocytes is abnormal. Or megaloblastic anemia is also characterized by RBCs that are larger than normal, and this is all because of vitamin B12 deficiency. So, what is the role of vitamin B12? It plays an essential role in the production of our red blood cells and DNA, as well as it keeps the proper functioning of our nervous system. So, lack of vitamin B12 leads to lot of problems in our body. It is a systemic disease because there is a problem in RBCs, and it is a most common manifestation of anemia. So, what is anemia? It is lack of blood, or a condition in which the blood doesn't have enough healthy red blood cells. It is mostly of autoimmune origin. This megaloblastic anemia results from विटामिन B12 malabsorption. That means कि विटामिन B12 का एब्जॉर्प्शन नहीं हो रहा है प्रॉपर्ली इंटेस्टाइन से, या फिर स्टमक के किसी पार्ट को सर्जिकली रिमूव कर दिया गया हो, और इट कैन बी ड्यू टू deficiency of vitamin B12 from diet source or from excess bacterial growth in intestine, where bacteria utilizes the vitamin B12 of the host, and host become lack of vitamin B12, which leads to multiple complications. Clinical manifestations. Normally, normal anemic patient shows symptoms like fatigue, weakness and shortness of breath. But because red blood cells is immature, red blood cells are abnormal, so oxygen carrying capacity is less, which leads to fatigue, dyspnea or dizziness. Fatigue is what? Thakawat. Dyspnea is difficulty in breathing, and dizziness is lightheadedness, और जैसे सर घूमता हो kind of symptoms. Coming to the main part, megaloblastic anemia leads to high output cardiac failure like tachycardia. Tachycardia is fast heart rate or rapid heartbeat that may be regular or irregular, and also left ventricular failure. Left ventricular is that part of our heart which supplies oxygenated blood to our body. So, it causes dysfunction of the left ventricle, which causes insufficient delivery of blood to vital body organs. Next is 2,3-diphosphoglycerate. ये ग्लाइकोलाइटिक इंटरमीडिएट है जो मेनली डीऑक्सीजनेटेड हीमोग्लोबिन के साथ बाइंड करता है. अब यहाँ पे एनीमिया में इसका क्या रोल है? जब ये डीऑक्सीजनेटेड हीमोग्लोबिन के साथ बाइंड करेगा तो ये ऑक्सीजन को हीमोग्लोबिन से बाइंड करने नहीं देगा. दैट मीन्स कि हीमोग्लोबिन ऑक्सीजन से बाइंड नहीं हो रहा है, so it leads to increased concentration of deoxygenated blood rather than oxygenated. Next is loss of muscle mass. GI symptoms, gastrointestinal symptoms mainly include malabsorption, diarrhea and glossitis. What is glossitis? Inflammation in tongue. Also in myelin synthesis, vitamin B12 serves as a cofactor. Deficiency of vitamin B12 also leads to neurologic symptoms, that is CNS and CNS related problem, that is brain and spinal cord related problems. Next is paraesthesias, that is numbness and tingling. Next is disturbances in balance and coordination. Next is dementia, that is memory, our thinking part, and chronic atrophic gastritis, inflammation in gastrointestinal part, and infiltrated by plasma cells and lymphocytes. Okay, next important clinical manifestations are macro-ovalocytes. These are enlarged oval shaped erythrocytes. मतलब ये इसमें जो हमारे एरिथ्रोसाइट्स हैं उनका साइज लार्ज हो जाता है और वो ओवल शेप के हो जाते हैं. ये हमें नॉर्मल पेशेंट्स में नहीं दिखते. ये मेनली मेगालोब्लास्टिक अनीमिया के केस में ही होता है. नेक्स्ट इज एनाइसोसाइटोसिस एंड पोइकिलोसाइटोसिस. और I have shown in this figure, anisocytosis is varying sizes of erythrocytes and poikilocytosis is varying shapes. So next is hypersegmentation, means presence of neutrophils whose nuclei have 6 or more lobes, or the presence of more than 3% of neutrophils with at least 5 nuclear lobes. Next is megaloblastosis. It is the cytomorphological hallmark of megaloblastic anemia resulting from vitamin B12 and folate deficiency. मतलब ये एक हॉलमार्क है जिससे कि पता चलता है कि मेगालोब्लास्टिक अनीमिया हुआ है. नेक्स्ट इज डीमाइलिनेशन. ओके, पैथोजेनेसिस. पैथोजेनेसिस में क्या होता है? मेनली ये स्टार्ट होती है with parietal cells with autoimmune destruction of parietal cells of the gastric gland. ये cells, parietal cells is the only source of gastric acid and glycoprotein intrinsic factor release and for absorption of vitamin B12. Therefore, destruction of parietal cells results in lack of gastric acid and intrinsic factor secretion. Apart from its digestive and macrobicidal function, gastric acid also it is required for release of cobalamin from food stuff. And what is cobalamin? It is vitamin B12. So the glycoprotein intrinsic factor binds cobalamin and is essential for its efficient absorption from terminal ileum. तो ये क्या करता है? कोवैलेमिन हेल्प करता है इलियम से एब्जॉर्प्शन में. अगर ये कोवैलेमिन का एब्जॉर्प्शन नहीं हो रहा है, गैस्ट्रिक एसिड का रिलीज कम हो रहा है और इंट्रिंसिक फैक्टर भी नहीं है, तो ये जो कोवैलेमिन की डिलीवरी हो रही है ब्लड में वो नहीं हो पाएगी. तो विटामिन B12 का डिफिशियंसी हो जाएगा बॉडी. For this autoimmune destruction of parietal cells, some evidences has been found. Like in case of pernicious anemia patients, their gastric mucosa has shown high atrophy with lymphocytic infiltration. Mainly B lymphocytes were seen. Also, more than 90% of patients have in their serum antibodies against protein found in parietal cell membrane. Also, they have mesored protein like sodium potassium ATPase, which is mainly responsible for the transport of hydrogen ions. Also, more than half of the patients have antibodies against intrinsic factor and also against the intrinsic factor cobalamin complex. Next is, patients of pernicious anemia have also shown high incidence for autoimmune diseases like Graves' disease. And corticosteroid, this therapy reverses the pathologic changes of pernicious anemia. Vitamin B12 is essential in the synthesis of DNA, but lack of vitamin B12 impairs synthesis of DNA. So, अगर हम ये बात करें कि विटामिन B12 कैसे रिस्पॉन्सिबल है, कैसे रिलेटेड है DNA के साथ, हम क्या जानते हैं? DNA में क्या होता है? DNA किससे बना है? बेसेस से, दैट इज प्यूरिन एंड pyrimidine bases. So, if any of the bases is not formed, then base pair will not form there. So lack of vitamin B12 leads to it impairs in the synthesis of purine. How? Cobalamin, that is vitamin B12, it accepts a methyl group from methyl tetrahydrofolate. First thing, that cobalamin will accept a methyl group from methyl tetrahydrofolate. Okay, तो अब क्या हो गया, कोबेलेमिन मिथाइल कोबेलेमिन बन गया और मिथाइल टेट्राहाइड्रोफोलेट सिर्फ टेट्राहाइड्रोफोलेट रह गया क्योंकि उसने एक अपना मिथाइल ग्रुप कोबेलेमिन को दे दिया. अब ये जो मिथाइल कोबेलेमिन है इसका मेजर रोल है. दिस इज रिक्वायर्ड फॉर द कन्वर्जन ऑफ होमोसिस्टीन टू मीथियोनिन, सेकेंड स्टेप. एंड द मेन पार्ट इज tetrahydrofolate is responsible as a single carbon donor in purine synthesis. So, if cobalamin deficiency will take place, that is from start here, if cobalamin deficiency will take place, then tetrahydrofolate stores will be depleted, due to which purine synthesis will be impaired. Because tetrahydrofolate is used as single carbon donor in purine synthesis, and if tetrahydrofolate is depleted, that means cobalamin is depleted, so it will lead to impairment in purine synthesis. Next, lack of vitamin B12 impairs myelination of neurons. So this is mainly because of methionine. Methionine deficiency causes demyelination of neurons, since demyelinating neuropathy is known to be produced by hereditary defects of methionine synthesis. Methionine synthesis की वजह से myelination होता है. अब क्या है, अगर methionine synthesis का inactivation हो गया nitric oxide, so by nitric oxide, then it also produces demyelination. Next is cobalamin is also required for synthesis of succinyl coenzyme A from methyl malonyl coenzyme A. So in case of deficiency of cobalamin, succinyl coenzyme A synthesis is also impaired. Therefore fatty acids जो कि responsible है myelin synthesis के लिए, वो भी may not be available, since succinyl coenzyme A is used for fatty acid synthesis. So thank you. Just read the presentation once, then you can refer any book. I have mainly followed S.C. Sharma, Understanding of Diseases, and Harsh Mohan, and some sources from Google. Thank you.